Hi everyone, it's Dr. Karen Leggett, the Women's Midlife Specialist, and today I'm going to talk about timing when you actually do your saliva or urine or blood testing of your hormones. So remember when I talked about BUST, B-U-S-T, when we talked about testing? B stood for blood, urine, U, saliva S, well T is the timing. So I have a few slides for you that I want to show you that'll be really easy for you to download and print, and then it'll be easy for you to remember. So let's go take a look at them now. Okay, so T stands for timing, and the time you do your testing is basically the same for all the types of tests. So whether you use urine or blood or saliva, it's going to be the same. So on the actual day of collection, you want to try to collect within 30 minutes of waking up. And basically, if you're not having periods, and you're lucky like me, not having periods anymore, then you can just collect any day of the month. If you are still having periods though, and they are regular periods, then the best days to collect your saliva or blood or urine is going to be on day 19, 20, or 21 of your cycle. And that's with day 1 being the very first day that you start your period. Now, if on the other hand, you have irregular cycles, then this is, really quite common a couple of years or more before you go through menopause, then your goal is to try and collect your sample in the second half of your cycle, the part after you ovulate. So normally we ovulate around day 14 of our cycles. So if you generally have irregular cycles that are less than 28 days long, or meaning less than 28 days between your periods, then you want to try to aim for 5 days before you think you're going to start your period. Another way to do it, if your cycles are less than 28 days apart, is to wait 2 weeks and 2 days after your period starts and then collect your sample. This would be the same as collecting it on day 16. This would be day 16 of your cycle, and that's perfectly good. Now, if your cycle is irregular and usually greater than 28 days in between periods, then you still want to try to aim for the same thing, that being 5 days before you think you're going to start your period. So let's just say, for example, you have a period every 6 weeks. What you would do in that situation is simply aim for 1 week earlier than the expected period, which would mean that you would take your sample 5 weeks after you start your period, and that would be a week before your 6 weeks cycle is up. Now, let's say you just have no regularity at all to your cycle, and sometimes that happens. Sometimes you have a cycle that is 6 weeks, and then maybe 1 3 months, and then maybe 1 3 weeks, and let's just say you have no regularity at all. Then don't worry about it. Don't worry at all. Just collect your sample when you aren't bleeding. Okay, so that's really it. That's how easy it is to figure out when to take it. So now let's talk about a couple of important timing issues if you're using hormones right now. If you follow these guidelines on this slide, you'll have good results. You'll be right in the reference ranges that the testing gives, and you will be able to have accurate testing results. Now, this is important to all of you who are on hormones now or start hormones later, because when you go to retest, you're going to want to follow this slide here. So, okay, let's use topical hormones. Number 1, let's look at that first. And topical hormones, I'm talking about creams or gels or sprays, or even topical vaginal hormones. You want to take your sample 12 to 24 hours after your last dose. You might have to adjust the timing of your dose a little the night before you plan to test. For instance, let's say you use progesterone to help you sleep, and you normally wake up at 7 a.m. and you use progesterone by cream, you'll need to apply your progesterone at 7 p.m. the night before you plan to take your sample instead of right before bedtime, because it needs to be 12 to 24 hours before you take your sample. Does that make sense? Okay, so there is an exception to progesterone rule, and it's only this one exception, and it has to do with oral progesterone, number 2 on this slide. Oral progesterone is very short-lived. It is only in your system for 6 to 10 hours. So you need to only wait 6 hours after your last dose before you collect your sample. And you should not wait longer than 10 hours after your last progesterone supplement. Okay, so that is because oral progesterone is short-lived in the body, and it is going to be out of your system in 10 hours. Now, all other hormones, though, estrogen, DHEA, pregnenolone, if you take them by mouth, number 3, if you take them orally, then you want to take your last dose 12 to 24 hours before you take your sample. Okay, now let's look at number 4. Troches or sublingual. SL stands for sublingual. So if you use sublingual or troche hormones, remember that saliva is not a good test for you. So a blood spot is a better choice, and you have only 6 to 10 hours after taking your last dose that you should collect your blood sample. So what this means is that if you take sublingual hormone, like let's say sublingual DHEA, for example, that's something that is pretty common over the counter, and a lot of women end up taking sublingual DHEA, but I really discourage that. But in any event, if you take sublingual DHEA, you will need to get your test, need to do your test, a blood test, if you want accurate results, 6 to 10 hours after your last dose. Okay, how about let's talk about number 5, the patches. That's really easy. If you wear a patch, such as an estrogen patch, plan to change your patch 1 to 2 days before your testing. So it's super easy. So let's say you put your patch on every Monday. You would test on Wednesday. You could test on Tuesday, but I would recommend on Wednesday, 1 to 2 days after you change your patch. And number 6 is about pellets. If you use injections or pellets, then you want to test your hormones during the midpoint of your pellet life expectancy. So for instance, let's say you use pellet estrogen and progesterone, and you have your pellets placed every 3 months, then your testing would occur at week 6 to reach that midpoint of the cycle. Now, if it has to be just a little off, not quite 6 weeks because of your menstrual cycle, don't worry about that. It's okay. Just try to stay as close to that mid-pellet insertion time as possible. And finally, there's one more consideration, and that's with the hormone 7-keto-DHEA, which some women take for weight loss. And if you take this hormone, you need to know that you have to wait 3 days after taking the last dose of 7-keto-DHEA before testing your hormones. Now, I'm talking about any hormones like estrogen, progesterone, testosterone, or DHEA. So you would take 7-keto-DHEA and then not take any more for 3 days before you plan to do your testing. Okay, well that's it. That's all you need to know about when to test your hormones. I hope you found this helpful. And if you like this video, give me a thumbs up and share this video with your friends. If you found this video on YouTube, then give me a thumbs up, subscribe to my channel, come on over and check us out at our Facebook site, and I'll see you there every day for an anti-aging secret on the way to work. All right, see you soon. Bye-bye.